Good evening. I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call here at the PBS Fort Wayne studios by dialing in the Fort Wayne area 969-2720, or if you're calling anywhere else, coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting every Monday night, live from our PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. That's mattersofthemind@wfwa.org. And I'll start tonight's program with an email I recently received. It reads, "Dear Dr. Fawver, what can you tell me about Cobenfy?" That'd be a capital C on Cobenfy. It's a trade name of a new medication. Is it any different than any other medication available for schizophrenia? Cobenfy was approved by the Food and Drug Administration about a month ago, and it will revolutionize the treatment of schizophrenia, either by itself or medications that follow it. Basically, it's not focusing on blocking dopamine. When we've talked about schizophrenia for the past 60 years, the treatment has always been focused on blocking dopamine right up here in the limbic system, right? So you have too much dopamine in the limbic system. When you have too much dopamine in the limbic system, you will hear voices that other people can't hear. And they're distinctive. They're as distinctive as my voice is to you right now. They're very clear and often very coherent voices talking to you when there's nobody around. Secondly, you'll have these fixed false beliefs, which we know of as delusions. Fixed false beliefs will be where something can't possibly be true, but you insist that it's true and you can't talk that person out of a delusion. Many people will have difficulty with concentration, focusing, they'll have distractibility, and many times they'll have overlap of other conditions like attention deficit disorder. They have trouble relating to other people, and that's called the autistic features of schizophrenia. So schizophrenia has been a debilitating condition that we've known quite a bit about for the past 60 years. We've known to at least block dopamine, but that has only been part of the story. Medical students are wonderful with whom to interact because I teach medical students in my free time, and they will ask you questions that need to be asked. And one of the questions medical students have been asking me for the past 30 years has been, okay, you have too much dopamine with schizophrenia. How come? And my response has characteristically been, I don't know. We don't know why there was too much dopamine with schizophrenia. And that's part of the problem where people have these hallucinations and delusions. But for the past 30 years, there's been a endeavor to try to discover why there's too much dopamine. And now we've understood why there is too much dopamine. It's because people with schizophrenia have underactive receptors involving acetylcholine, okay? Acetylcholine is an important chemical in the brain. Acetylcholine 30 years ago was thought to be the sole reason for people with Alzheimer's dementia thinking they had too little acetylcholine. So acetylcholine is an important chemical, and acetylcholine will balance out with dopamine. It's like a teeter-totter. I've talked about with depression, GABA and glutamate being in need of balance. In the same way, acetylcholine needs to be in balance with dopamine. So if you block dopamine, you can get too much acetylcholine and have various symptoms such as tremulousness and shuffling gait. And we call them Parkinsonian symptoms. So what do you do then? You block dopamine to try to you block acetylcholine to try to bring the acetylcholine balance down to dopamine. So we've known about blocking dopamine because there is too much dopamine, and then offsetting the excessive acetylcholine effect from that by blocking acetylcholine. And the bottom line is, our outcomes have been okay, but not the greatest. Well, now we have an entirely different mechanism with the use of Cobenfy. Cobenfy is a medication that's two medications in one. The main medication is a medication that will stimulate these receptors that are understimulated or under the too little volume. One of them is called muscarinic receptor 1, and one is called muscarinic receptor type 4. These are acetylcholine receptors. They are underdeveloped in people's brains who have schizophrenia, probably starting in the womb. It starts early on, and some people have triggers for schizophrenia where the symptoms will evolve, but people will have too few muscarinic 1 and too few muscarinic 4 receptors in the brain. There's 5 different types of muscarinic receptors. type 1, 2, 3, and 4, and 5. Okay, we're talking about muscarinic receptor 1 and muscarinic receptor type 4. Muscarinic receptor type 1 are located primarily in the gray matter of the brain, and they're also located in the salivary glands as well as the gut. Muscarinic receptors type 4 are located over here in the hippocampus, the memory part of the brain. That's the part of the brain that helps you process thoughts and memories, and also in the inside part of the brain called the substantia nigra in the middle of the brain. So these parts of the brain will affect a person's ability to maintain reality. And if you have too few receptors of muscarinic receptor type 1 or muscarinic receptor type 4, you're more prone to release more dopamine. So if you don't have enough of the muscarinic 1 and 4 receptors, you're going to release more dopamine. That answers the questions the medical students have been asking me for decades. Why is there more dopamine? Now I can tell them it's because people with schizophrenia have too few of the muscarinic 1 and 4 receptors. Now why is that important? Think of dopamine as being an accelerator in a car. If the accelerator is left unchecked with braking and there's nothing there to slow down the accelerator, the car will go too fast and often be out of control. That's what happens to people's brains when they have psychotic symptoms and they've lost touch with reality. The brains feel like they're out of control. They have racing thoughts, they can't think straight, and they have these hallucinations and delusions. So the brain's out of control. It's like a speeding car. So how do you try to slow down a speeding car? One way you can slow it down is by having big semis and big trucks and other cars in front of the speeding car to slow it down and to block its progress. That's what we've been doing to treat schizophrenia for the past 6 decades. We've merely been blocking dopamine receptors, and in doing so, it's helped, but it doesn't get to the underlying problem. If you stimulate the receptors that are at lower volume, muscarinic 1 and 4 receptors, if you stimulate those receptors, you're actually getting to the core cause of the excessive dopamine. Stimulating those receptors will decrease the amount of dopamine being released, and it's kind of like letting off the accelerator in doing so. So when you look at the package insert, which is basically the instruction sheet that the Food and Drug Administration publishes, the instruction sheet on Cobenfy doesn't even mention dopamine. It's a downstream effect. The main mechanism of action of Cobenfy is the acetylcholine mechanism. It's a whole different way of attacking this problem, which is really getting to the core issue. So, like with any medication, you're going to have side effects. If you stimulate muscarinic receptors 1 and 4, what do you get? What do you have in terms of side effects? You have slobbering. We've seen that for years with a medication called clozapine or Clozaril. A side effect of it is slobbering. That's because it's a really good muscarinic 4 and a muscarinic 1 receptor stimulant. So if you stimulate those receptors, you get slobbering. You can get a slowed down heartbeat. You can get diarrhea. You can have some uncomfortable physical effects from stimulating those receptors. So that's the reason why there's a second medication in Cobenfy. The second medication is blocking in the periphery, not in the brain, but blocking in the periphery those side effects that you can get. So that's why it's weird, because people will say, gee, on the side effect profile of Cobenfy, it's diarrhea, and on the other hand, another side effect is constipation. Well, the diarrhea is coming from one medication that is stimulating the muscarinic 1 receptors, and the constipation is where you get too much of the second medication in your system and gives you constipation. So it's important to get that fine balance between those two medications for people. But it's a medication that I think is going to change our whole thinking about schizophrenia. In the past, we've always been all about blocking dopamine, and that helps with a psychosis. My goodness, back in the 1950s, when a medication like Thorazine followed by Haldol, those medications came out, it literally did significantly empty out a lot of state hospitals where people had been housed for years with schizophrenia. So they are effective medications in some degree, but it's how they are effective. If you got the speeding car, would you rather block it with semis and keep it from going so fast by putting things in front of it, or would you rather go directly to the accelerator and try to let off the accelerator? What we're doing with Cobenfy in the treatment of schizophrenia is not just blocking the dopamine, but we're actually decreasing the likelihood that the cause of the increased dopamine is problematic. So it's something you're going to be hearing about over the course of time. I believe that future medications being developed for schizophrenia will all mirror this type of mechanism of action, where they're going to be looking at the core reason why there's excessive dopamine in schizophrenia. Thanks for your email question. Let's go to our first caller. Hello, Samuel. Welcome to Matters of Mind. Hello, Samuel. Well, you wondered if you have severe anxiety Is there a chance that your kids will develop anxiety? My face kind of looks like a half moon tonight, doesn't it? Yes, the answer there is, if your children see that you as a parent have a significant amount of anxiety in life circumstances, they will mirror that kind of behavior. So yes, your children do pay attention to you, especially if they're under the age of 8 years of age. That's when a lot of their personality development is occurring. But when you have children mirroring your behavior, if you're anxious in different situations and you're having difficulty with resilience and putting up with stuff, you bet your children are going to notice that. But there's about a 30% biological factor there going on where, yeah, there are some genetics involved with anxiety, but I think for the most part, anxiety can be a learned behavior from children watching and mirroring and mimicking their parents' responses to stressful situations. Samuel, thanks for your call. Let's go to our next caller. Hello, Alex. Welcome to Matters of Mind. Alex, you want to know, why do you have trouble sleeping without noise? You can't sleep without music or television playing. Be careful about television, Alex, because the bright screen of a television screen can keep you awake. Back in the old days, we had the dimmer screens. Now we have these bright LCD screens that the light itself can keep you awake. Same with computer screens. So be careful about the television screen. Music or television sounds in the background can be somewhat calming because it'll keep your mind from having to think about stuff. And this is not an uncommon type of tactic people will attempt, Alex, where they will notice that if they have music playing in the background, music will stimulate this little part of the brain here, the auditory cortex. And if you're stimulating that part of the brain, you're kind of thinking about listening to the music in the background, it can shut down some of your extraneous thinking. So that's why some people will notice that if they play classical music where it's kind of in the background, but it's not something that's annoying you or causing you to have a lot of thought behind it, you can actually increase your focus of your brain, which is in the front part of the brain. So if you have noise in the background, you're not going to notice, maybe a limb falling down outside or car noises. You're not going to notice those extraneous noises outside the house. You'll hear the soft, quiet, we call it white noise that's in the background. It's actually a recommendation that many people will receive from us clinicians to have some white noise in the background to be able to sleep better. But you're hearing the white noise and it cuts down your ability to hear extraneous sounds that might keep you awake otherwise. Alex, thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, is there any hope for someone who spent most of their 58 years of life feeling unloved and unwanted with a broken spirit? I have no interest in living. Medication and therapy does not help. Well, keep in mind, number one, you need to contact your primary care clinician, your mental health clinician, anybody who you have in mind. Anybody who's available, you should contact them if you have any thoughts of taking your life with severe depression. You don't want to simply call a television show and talk to some guy on PBS about wanting to kill yourself. You need to talk to the proper professionals right away. And there's a hotline that's where you dial 988, and you can always be directed to a mental health clinician that way. So with that being said, let's talk about depression that's just not getting better. Okay, you mentioned it's been going on for 58 years. There's a lot of different assessments we'll do for depression. Right off the bat, we want to make sure that what you're dealing with will be depression itself. Is it bipolar disorder where you're having highs and lows? Is it simply lows? When you say medication hasn't helped, keep in mind we have 29 different oral antidepressants available for the treatment of depression nowadays. I bet you haven't taken all 29 of them. Secondly, we have Spravato, which is a nasal spray affecting glutamate. Now, traditionally for the past 6 decades, the main medications we've had for depression mainly affect norepinephrine, serotonin, and dopamine. If you affect glutamate, you can get an entirely different type of an effect compared to the prior medications, and it can be a very fast effect. There's also an oral medication that came out 2 years ago called Auvelity. It's an oral medication that affects glutamate. And then we have some so-called off-label uses of a medication like ketamine. Ketamine was approved in 1970 for anesthesia. It's been around for a long time. And it was approved for anesthesia, but it can be given IV, and some people have even tried to use it under the tongue as a means of helping with depression. Ketamine, used for anesthesia, can be a very, very potent and effective medication for depression. So before saying, I've tried everything for medication and it hasn't helped, often what we do now in the 21st century is we'll start with medication to allow the brain to reason better and allow you to concentrate better. Then once the medication is allowing your brain to work better, then we get into the behavioral type of aspects of talk therapy. We talk about diet and exercise, all these things that tend to go downhill when people are severely depressed. So I would certainly talk to your primary care clinician, make sure you don't have any underlying medical issues like diabetes, thyroid disturbances, iron disturbances, sleep apnea. These are all conditions that can cause a person not to respond to various antidepressant medications, but your primary care clinician might have some other ideas for you concerning what else can be done for what we'd call treatment refractory depression, which is what you're describing at this point. It's refractory maybe because the medications you've tried, they haven't worked because they haven't hit the proper neurotransmitters. And it's not just all about neurotransmitters, but your brain's got to work properly for you to be able to think clearly. And to think clearly, that gives you rational thoughts. And of course, that allows you to have enjoyment and motivation to be able to have fun in life in general. So I wish you the best, but talk to your primary care clinician as soon as possible here. Thanks for your email. Let's go to our next caller. Hello, Bonnie. Welcome to Mayor's the Mind. Bonnie, you want to know, what is attention deficit hyperactivity disorder? What are the symptoms? What are the effects? And is there a medication you can take for it? ADHD, Bonnie, is a condition that starts in childhood by definition. It's a day-to-day phenomenon that can be worsened based on different stressful situations you're under. People with attention deficit hyperactivity disorder, as the name implies, have difficulty with attention span, distractibility, and they have a hard time getting things done. They get started on things, but they don't get them done. They have a hard time focusing on things that aren't very interesting, which describes a lot of things we have to endure in life, especially in our school system. So if you're not challenged, if you're not interested, if it's not new and exciting for you, you might not be able to pay attention to it. But interestingly enough, Bonnie, people with ADHD typically have higher IQs compared to people without ADHD. So we have to remember that, yeah, we call it a developmental disorder because it does affect the front part of the brain. Front part of the brain appears to be underactive with people with ADHD. The attention part of the brain over here on the left side, called the dorsal lateral prefrontal cortex, the orbital frontal cortex up here above the eyeball, orbital lateral, orbital frontal part of the cortex. That's the part of the brain that you use for controlling your impulses. These are impaired with ADHD. The middle part of the brain, called the cingulate gyrus, is impaired. That's accounting for the distractibility. So it's a biological problem where as you grow older, up to the age of 24 years of age, those parts of the brain will grow and grow. But many people, even as adults, will still have lingering symptoms of ADHD that may or may not be problematic. If they're problematic, you certainly would want to consider getting treatment for it. With ADHD, there's different severities of ADHD, just like there's different severities of nearsightedness. When you have nearsightedness, some people can wear really thin lenses on their glasses and they do fine. Other people need really thick lenses because they have very severe nearsightedness. Well, that's the way we will consider ADHD. Some people have ADHD where it's not really a problem until they get into graduate school and they're just overwhelmed with keeping up with things. Before, they were able to get all their homework done in high school, maybe in a study hall, something like that, and they just blew through high school, no problem at all. But they got challenged to a certain degree, and that's where they're devastated. Now, for other people, they have such severe ADHD, they're out of control with impulsivity and decision-making, even as adolescents, they get themselves into trouble, and that's why in the prison systems, it's thought that half the inmates in prison systems have a history of ADHD because it causes them to have difficulty with impulse control and decision-making in general. So it's important we identify it. Does everybody need treatment for it? Not necessarily. If it's not causing you significant impairment, that's not problematic. Many people with ADHD come across as being very charismatic and they're fun and they're a joy to be around because they're going from thought to thought to thought to thought. But at the same time, they'll describe to you having difficulty getting things done. I just saw a woman earlier today who had ADHD, and she's in her 30s, and she just said she can't get anything done around the house. And it takes her 3 hours to get what should just take her to get done in 30 minutes. So with ADHD, it causes you to be very inefficient in doing mundane type of activities. So something as simple as washing the clothes and getting the laundry done can take days in some cases because you get distracted, you go to something else, and you don't get the initial type of project done. So that's one of the symptoms of ADHD. It can cause problems in that way. It can cause marital stress in some cases because when a spouse has ADHD, he or she comes across as being uncaring and a poor listener to the other spouse because their brain's going off in some other direction as their spouse is speaking to them. So those are the consequences of ADHD. Are there medications that we can take? There are medications that we can take. Non-stimulant medications will primarily affect the front part of the brain and fire that up. Non-stimulant medications will help anywhere between 60 to 80% of the time. So we have those available now. There are stimulant medications that have been around for decades now. They're long-acting, so you have the Ritalin-type products and you have the amphetamine-type products. The long-acting ones are the ones we prefer because they're less addictive. They're giving you a slower release throughout the day. They're not wearing off and causing you to crash early afternoon. So we like the medications that are stimulants that will last for 8 to 10 hours and last throughout most of the day. But the non-stimulant medications can also work to some degree, but not as well as the stimulants will. So there's a lot of different medications that are available for ADHD, really for people of all ages. The stimulant medications, as you might guess, can be a little bit more difficult to take for people who have heart problems because they can increase the blood pressure, increase the heart rate, and sometimes cause rhythm disturbances of the heart. So we have to be careful with a lot of older adults if they take stimulant medications because they can have heart issues themselves. Bonnie, thanks for your call. Let's go to our next email. Our next email reads, Dear Dr. Fawver, is it normal to feel depressed when your adult children finally leave home? Well, if your adult children leave home and they're living independently and they're having fulfilling lives, give yourself a pat on the back because you succeeded as a parent. That's what's supposed to happen. The birds have left the nest. That's a good thing. Is it normal to feel depressed and sad? Of course. I mean, you miss them. But in today's world, you can text them, you can email them, you can communicate with them on a regular basis. So it's not like the old days where we had to write letters and communicate in that manner. Now we can text them, we can FaceTime. There's a lot of ways to maintain contact. But yeah, you miss them. It's important as a so-called empty nester to try to fill up that nest with hobbies, with friends, with social activities, a lot of other things you could do in the absence of your children. But give yourself credit. If your children have left the home, they're getting on with their lives, that's a good thing. That's what we want. We don't want our children to be camping out with us as adults. So thanks for your email. Let's go to our next caller. Hello, Paula. Welcome to Matters of the Mind. Paula, you had heard me talking about ADHD. Is constant daydreaming and forgetfulness a sign of ADHD? Yeah, people with ADHD, with women especially, you'll hear about daydreaming. They're not really impulsive. They're not hyperactive. That's referred to as ADD, predominantly inattentive type. It's where they just kind of daydream and they'll go off in their own worlds and they can't focus and concentrate. More commonly seen with women than men. And that's why young girls and adolescent girls are often not identified as having attention deficit disorder because they don't cause any problems. So they're quietly daydreaming and they're not able to complete their assignments and focus on the work at hand. So daydreaming is certainly a symptom. Forgetfulness is a symptom of ADHD because you're not downloading the information in your hippocampus. Your hippocampus is the part of your brain that's kind of like the library. It's the memory center of their brain. With ADD, you're not downloading the information into the hippocampus, so that is a symptom of attention deficit disorder itself. Thanks for your call. Let's go to our next caller. Hello, Charles. Welcome to Matters of the Mind. Charles, you'd asked, why does having a photographic memory make it stressful to say goodbye to people? I'm not following the gist of your question there, Charles. Having a photographic memory make it stressful to say goodbye to people. I'm not going to answer that. You might want to call back in and let's get you on the phone so I can talk to you about that because I really don't know where you're going with that question. So let's go to our next email question. Our next email question says, Dear Dr. Fawver, how can I tell if I have chronic stress, and are there any lifestyle changes that might help prevent chronic stress? Chronic stress basically is not all bad. I mean, a stress basically is where somebody is having changes in their lives. Now, a change in your day-to-day activity is good for all of us. It makes us stronger, it makes us more resilient, it makes us tougher in the event of other stresses because if you endure past changes, you're more confident and you're more able and you develop coping skills to tackle future stresses. So a stress is simply a change. That's not a problem. When you have problematic stress, it's incapacitating. It causes you to have difficulty with sleep, anxiety, and you can't overcome it. and you feel overwhelmed and you feel anxious, and anxiety leads to insomnia. Insomnia eventually can lead to depression, and then it cascades to all these different things. So chronic unmitigated stress, where it's causing you to have difficulty coping with life circumstances, will actually have a physical effect on the brain, where your little neurons, which are supposed to be fluffy, you should have anywhere between 20,000 to 50,000 little branches on each individual neuron in your brain. Well, those branches get more shriveled up if you're under chronic unmitigated stress in which you're not dealing with. So it will have an effect on the brain, and in doing so, you can have difficulty with being able to concentrate, being able to feel motivated, having energy, and so forth. So if you have unmitigated stress where it's just pounding at you and you can't get over it, yeah, it will have an effect on you. Number one, try to identify in your stressful life circumstances what you can and cannot do about those different situations. Number two, exercise. It's one of the best ways that you can deal with stress. And number three, keep a diary. And then take a look at that diary 3 months from now. Give yourself some confidence that that stress that felt overwhelming for you now, yeah, stuff happened, you got over it. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions concerning mental health issues that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. God willing and PBS willing, I'll be back again next week. Thanks for watching. You've been watching Matters of the Mind on PBS Fort Wayne. Have a good evening. Good night.
Preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.